Hello students, in this video I am going to talk about chapter number 24 of Guyton, which is circulatory shock and its treatment. So look at the first line of the chapter. Circulatory shock means generalized inadequate blood flow to the body to the extent that the body tissues are damaged, especially because too little oxygen and other nutrients are delivered to the tissue cells. Even the cardiovascular system itself, the heart, the wall of the blood vessel, vasomotor system, and other circulatory parts begin to deteriorate. So the shock, once begin, is prone to become progressively worse. Now the next heading, that is the physiological causes of shock. Circulatory shock caused by decreased cardiac output. Circulatory shock caused by decreased cardiac output. Circulatory shock without diminished cardiac output. There are two headings. Circulatory shock caused by decreased cardiac output is underline or highlight this. Shocks usually result from inadequate cardiac output. Therefore, any condition that reduces the cardiac output far below normal may lead to circulatory shock. Two types of factors can severely reduce cardiac output: cardiac abnormalities that decrease the ability of the heart to pump blood. And these abnormalities include in particular myocardial infarction, but also toxic states of the heart, severe heart valve dysfunction, heart arrhythmias, and other conditions. The circulatory shock that results from diminished cardiac pumping ability is called cardiogenic shock. Next is the factors that decrease venous return also decrease cardiac output because the heart cannot pump the blood that does not flow into it. The most common cause of decreased venous return is diminished blood volume, but venous return can also be reduced as a result of decreased vascular tone, especially of the venous blood reservoirs or obstruction to blood flow at some point in the circulation, especially the venous return pathway of the heart. Circulatory shock without diminished cardiac output. Occasionally, cardiac output is normal or even greater than normal, yet the person is in a state of a circulatory shock. This situation can result from excessive metabolic rate, so even a normal cardiac output is inadequate, or abnormal tissue perfusion pattern, so most of the cardiac output is passing through blood vessel beside those that supply the local tissue with nutrition. The specific causes of shock are discussed later. For the present, it is important to know that all of them lead to inadequate delivery of nutrients to critical tissues and critical organs, as well as inadequate removal of cellular waste product from the tissue. No need to, we have already talked about this in the slides. What happens to the arterial pressure in the circulatory shock? In most type of shock, especially shock, the second paragraph, in most type of shock, especially shock caused by severe blood loss, the arterial blood pressure decreases. At the same time, the cardiac output decreases, although usually not as much. Tissue deterioration is the end result of circulatory shock. Once circulatory shock reaches a critical state of, highlight all the points which I am speaking. Once circulatory shock reaches a critical state of severity, regardless of its initiating cause, the shock itself leads to more shock. That is, the inadequate blood flow causes the blood tissue to begin deteriorating, including the heart and circulatory system. This deterioration causes even greater decrease in cardiac output, and a vicious cycle ensues with progressively increasing circulatory shock, less adequate tissue perfusion, more shock, and so forth until death occurs. It is with this late stage of circulatory shock that we are especially concerned, because appropriate physiological treatment can often reverse the rapid slide to death. Now let's come to the next page and stages of shock. So highlight these three stages. The non-progressive stage, that is known as compensated stage, in which the normal circulatory compensatory mechanisms eventually cause full recovery without help from the outside therapy. A progressive stage, in which without therapy the shock becomes steadily worse until death occurs. An irreversible stage, in which the shock has progressed to such an extent that all form of known therapy is inadequate to save the person's life, even though for the moment the person is still alive. Shock caused by hypovolemia, hemorrhagic shock. Highlight this heading. Hypovolemia means diminished blood volume. Hemorrhage is the most common cause of hypovolemic shock. Hemorrhage decreases the filling pressure of the circulation, as a consequence, decrease in venous return. As a result, the cardiac output falls below normal and shock may ensue. So this is all. Highlight this, the sympathetic reflex compensation in shock, their special value to maintain the arterial pressure. The decrease in arterial pressure after hemorrhage, as well as decrease in pressure in pulmonary arteries and veins in the thorax, are powerful sympathetic reflexes. These reflexes stimulate the sympathetic vasoconstrictor system in most tissues of the body and result in three important effects. The artery will constrict in most part of the systemic circulation, thereby increase the total peripheral resistance. The vein and the venous reservoir constrict, thereby helping to maintain adequate venous return despite diminished blood volume. Heart activity increased markedly, sometimes increasing the heart rate from a normal value of 72 beats per minute to as high as 160 to 180 beats per minute. Next is the value of the sympathetic nervous reflexes. In the absence of sympathetic reflexes, only 50 to 20% of the blood volume can be removed over a period of 30 minutes before a person dies. In contrast, a person can sustain a 30 to 40% loss of blood volume when the reflexes are intact. Therefore, the reflexes extend the amount of blood loss that can occur without causing death to about twice that which is possible in their absence. The next thing is let's come to the next page. And see the heading: non-progressive shock, compensated shock. If shock is not severe enough to cause its progression, the person eventually recover. Therefore, shock of this lesser degree is called non-progressive shock or compensated shock, meaning that the sympathetic reflexes and other factors compensate enough to prevent further deterioration of the circulation. The factor that cause a person to recover from moderate degree of shock are all the negative feedback control mechanism of the circulation that attempt to return cardiac output and arterial pressure back to normal value. So they include the baroreceptor reflexes, which elicit powerful sympathetic stimulation of the circulation; central nervous system ischemic response, which elicit even more powerful sympathetic stimulation throughout the body, but is not activated significantly until the arterial pressure falls below 50 millimeters of mercury; reverse stress relaxation of the circulatory system, which causes the blood vessels to contract around the diminished blood volumes, where the blood volume that is available more adequately fill the circulation; increased secretion of renin by the kidneys and formation of angiotensin 2, which constrict the arteriole and cause decreased output of water and salt; increased secretion by the posterior pituitary gland of vasopressin ADH, which constrict the arterioles and veins and greatly increase water retention by the kidneys; increased secretion by the adrenal medulla of the epinephrine and norepinephrine, constrict the peripheral arterioles and veins, and increase the heart rate. Compensatory mechanism that return the blood volume back towards normal, including absorption of large quantity of fluid from the intestinal tract, absorption of fluid in the blood capillaries from the intestinal spaces of the body, conservation of water and salt by the kidneys, and increased thirst and increased appetite for salt, which makes the person drink more water and eat salty food if they're able to do so. Highlight till here and highlight this figure as well, figure 24.3. The next is the progressive shock is caused by the vicious cycle of cardiovascular deterioration. Cardiac repression: when arterial pressure falls low enough, coronary blood flow decreases below that required for adequate nutrition of the myocardium. Highlight this line. Now let's come to the next page and highlight this. That's one of the important feature of progressive shock, whether it is hemorrhagic or caused in other ways, eventual progressive deterioration of the heart. In the early stages of shock, this deterioration play a very little role in the condition of the person, partly because deterioration of the heart is not severe during the first hour or so of shock, but mainly because the heart has tremendous reserve capability that normally allow it to pump 300 to 400% more blood than is required by the body. In the late stage of shock, however, deterioration of the heart is probably the most important factor in the final lethal progression of the shock. Then just highlight these points: vasomotor failure. No need to go into details. If you want to read, you can read. Blockage of very small vessels by sludge blood. Increased capillary permeability. You must know these points. The next is release of toxin by ischemic tissue. The other is cardiac depression caused by endotoxin. And then there is generalized cellular deterioration. That's all about this page. Let's come to the next page. You must know that tissue necrosis and shock, patchy area of necrosis occur because of the patchy blood flow in different organs. Not all cells of the body are equally damaged by shock, because some tissues have better blood supply than others. For instance, the cell adjacent to the arterial end of capillary receive better nutrition than the cell adjacent to the venous end of the same capillaries. Therefore, more nutritional deficiency occurs around the venous end of the capillaries than elsewhere. Now let's come to and the acidosis in shock. This is important. Metabolic derangement that occur in shock tissue can lead to acidosis. Whatever I am speaking, please highlight this text. Can lead to acidosis all through the body. This results from poor delivery of oxygen to the tissue, which greatly diminish oxidative metabolism of the foodstuff. When this occurs, the cell obtain most of the energy by the anaerobic process of glycolysis, which leads to tremendous quantity of excess lactic acid in the blood. In addition, poor blood flow to tissue prevent normal removal of carbon dioxide. The carbon dioxide react locally in the cells with water to form high concentration of intercellular carbonic acid, which in turn react with various tissue chemicals to form additional intercellular acidic substances. Another deteriorative effect of shock is both generalized and local tissue acidosis that led to the further progression of the shock. Positive feedback deterioration of tissue in shock and the vicious cycle of progressive shock. All the factors just discussed which can lead to further progression of shock or type of positive feedback, that is each increase in degree of shock cause a further increase in the shock. Highlight till here. Now let's read the irreversible shock. After shock has progressed to a certain stage, transfusion or any other type of therapy become incapable of saving the person's life. The person is then said to be in irreversible stage of shock. Ironically, even in this irreversible stage, therapy can on rare occasion return the arterial pressure and even the cardiac output to normal or near normal for a short period, but the circulatory system nevertheless continues to deteriorate and death ensues in another few minutes to few hours. Now let's come to the next page. The heading: depletion of cellular high energy phosphate reserves in irreversible shock. We have already talked about this in this slide. The high energy phosphate reserve in the tissue of the body, especially in the liver and the heart, are greatly diminished in severe shock. Essentially, all the creatinine phosphate has been degraded, and almost all the adenosine triphosphate has downgraded to ADP, AMP, and eventually adenosine. Highlight till here. Much of this adenosine then diffuses, also highlight this, out of the cell in circulating blood, and is converted to uric acid that cannot re-enter the cell to reconstitute the ATP system. New adenosine can be synthesized at a rate of only about 2% of the normal cellular amount, meaning that once high energy phosphate stores are depleted, they are difficult to replenish. This is one of the most devastating and resulting shock, and the one that is perhaps the most significant for development of the final state of irreversibility is the cellular depletion of these high energy compounds. Next heading, hypovolemic shock causes plasma loss. Highlight intestinal obstruction may cause severely reduced plasma volume. Distension of the intestine in intestinal obstruction block venous blood flow in the intestinal wall, which increase intestinal capillary pressure. This pressure increase in turn causes the fluid to leak from the capillaries into intestinal wall and also the intestinal lumen. Because the lost fluid has high protein content, the result is reduced total plasma protein as well as reduced plasma volume. Severe burns on the denuding condition of the skin cause loss of plasma to the denuded skin areas where the plasma volume become markedly reduced. The loss of fluid from all fluid compartment of the body is called dehydration. Then hypovolemic shock caused by trauma. One of the most common cause of circulatory shock is trauma to the body. Often the shock results simply for hemorrhage caused by the trauma, but it can also occur even without hemorrhage because extensive contusion of the body can damage the capillaries sufficiently to allow excessive loss of plasma into the tissue. This phenomenon results in greatly reduced plasma volume, result in hypovolemic shock. Neurogenic shock. Shock occasionally results without any loss of blood volume. Instead, the vascular capacity increases so much when the normal amount of blood is incapable of filling the circulatory system. One of the major causes is the sudden loss of vasomotor tone throughout the body that results especially in massive dilation of the veins. The resulting condition is known as a neurogenic shock. Cause of neurogenic shock, you must know the causes: deep general anesthesia, spinal anesthesia, or brain damage. Anaphylaxis. Anaphylaxis, highlight this, is an allergic condition with the cardiac output and arterial pressure often decrease drastically. It results from an antigen-antibody reaction rapidly occur after an antigen to which the person is sensitive enter the circulation. One of the principal effects is to cause a basophil in the blood mass and the pericapillary tissue to release histamine or the histamine-like substance. The histamine causes increase in vascular capacity because of the venous dilation, thus causing a marked decrease in venous return. Dilation of the arterioles resulting in greatly reduced arterial pressure and greatly increased capillary permeability. The next thing is a septic shock. Septic shock, a condition formerly known by the name blood poisoning, is called septic shock by most clinicians. Refer to a bacterial infection widely disseminated to many areas of the body, with the infection being borne through the blood from one tissue to another and cause extensive damage. There are many varieties of septic shock because of many types of bacterial infection that can cause it, and because infection in different part of the body produce different effect. Most cases of septic shock, however, are caused by gram-positive bacteria, followed by endotoxin-producing gram-negative bacteria. Some of the typical causes of septic shock include the following: peritonitis. Highlight all these 4 points and all the text you must know. So just not the whole test, just remember peritonitis resulting from spread of infection, causes spread of infection from the uterus and fallopian tube. Then highlight peritonitis resulting from rupture of the GIT system, generalized body infection resulting from spread of skin infection, and generalized gangrenous infection resulting specifically from gas gangrene. Then what is the special feature of septic shock? High fever, marked vasodilation, high cardiac output, sludging of the blood, development of micro blood clots in widespread area of the body, a condition called disseminated intravascular coagulation. Now, last thing, the physiology of treatment in shock. Blood and plasma transfusion. If a person is in shock caused by hemorrhage, the best possible therapy is usually transfusion of whole blood. If the shock is caused by plasma loss, the best therapy is the administration of plasma. When dehydration is the cause, administration of an appropriate electrolyte solution can correct the shock. Whole blood is not always available, such as under battlefield conditions. Plasma can usually substitute adequately for whole blood because it increases the blood volume and restore normal hemodynamics. Plasma cannot restore a normal hematocrit level, but the human body can usually stand a decrease in hematocrit to about half to normal before serious consequences result if cardiac output is adequate. Sometimes plasma is unavailable. In these instances, various plasma substitutes have been developed that perform almost exactly the same hemodynamic functions as plasma. Then treatment of neurogenic and anaphylactic shock with sympathetomimetic drug. Sympathetomimetic drug is a drug that mimics sympathetic stimulation. These drugs include norepinephrine, epinephrine, and a large number of non-acting drugs. They have the same effect as epinephrine and norepinephrine. 2 types of shock sympathetomimetic drugs have to be especially beneficial. The first of these is neurogenic shock, and when the sympathetic nervous system is severely depressed, administering a sympathetomimetic drug takes the place of a diminished sympathetic action and can often restore full circulatory function. The second type of shock shock, in which sympathetic drugs are valuable, is anaphylactic shock, in which excess histamine play a role. The sympathetic drugs have vasoconstrictor effect. They oppose a vasodilating effect of histamine. Therefore, epinephrine, norepinephrine, or other sympathetic drugs are often life-saving. Other therapy, treatment by the head down position when the pressure falls too low in most type of shock, especially in hemorrhagic and neurogenic shock, placing the patient with the head at least 12 inches lower than the feet, help in promoting venous return. They're also increasing cardiac output. This head down position is the first essential step in the treatment of many type of shocks. Oxygen therapy, because a major deleterious effect of most type of shock is too little delivery of oxygen to the tissue. Giving the patient oxygen to breathe can be of benefit in some instances. Treatment of glucocorticoid hormones that control glucose metabolism are frequently given to patients in severe shock for several reasons. Experiments have shown empirically that glucocorticoid frequently increases strength of the heart in the late stage of shock, and glucocorticoid stabilize lysosome and tissue cells and thereby prevent release of lysosomal enzymes. Third, glucocorticoid might aid in the metabolism of glucose by the severely damaged cells. Circulatory arrest, a condition closely allied to the circulatory shock, is circulatory arrest, in which all blood flow stops. This condition can occur as a result of cardiac arrest or ventricular fibrillation. An important chapter. Integrate this with the slides. I hope this is going to help you. Thank you.